Welcome to Traditions Behavioral Health. My name is Dr. Gary Hayes, and I started Traditions Behavioral Health over 20 years ago. In the past in TBH, most of our doctors worked conventional jobs. They came to work 20 days per month, 8 hours a day. And so today I want to talk with you about the exciting new offerings that we have in TBH, which really provide flexibility to our physicians. Many of our lifestyle-oriented doctors have plentiful obligations in other aspects of their life, and we really wanted to pivot toward them and offer them different ways to make the same salary. So let's start there. The salary at TBH is $300,000 per year plus $10,000 in bonuses and a full $80,000 benefit package. Now, TBH is agnostic as to whether the doctor comes to work 20 days per month, where they work an 8-hour day, or whether they come to work 16 days per month, where they work a 10-hour day, or if they come to work 12.5 days per month for a 12-hour day, or 8.5 days per month for a 16-hour day. Whichever is the alternative that works for the doctor, it works for TBH. So in the first model, 20 days per month, the doctor is working Monday through Friday, 8 a.m. to 5 p.m. And in the second model, which is the 16-hour shift, the doctor is working 8 a.m. to 6 p.m. as a continuous shift. They combine their two 15-minute paid breaks into what is effectively a paid lunch, and it's a continuous shift, and they're all done in 10 hours. Similarly, in the 12.5 12-hour days, they work perhaps Monday, Tuesday, Wednesday, 7 a.m. to 7 p.m., repeat times 4. The most popular, though, I have to say, is the 8.5 16-hour shifts. In that, the doctor comes to work at 7 a.m. and works until 11 p.m. for 4 days in a row. So it might be January 1st, 2nd, 3rd, and 4th. And you're probably thinking how grueling that would be to do that. But then the doctor is off for perhaps as much as 12 days before they return to work January 19th, 20th, 21st, 22nd. So it's a combination of 16 grueling hour shifts that are for 4 days in a row, coupled with plentiful restful days off. The exciting part of this is it allows our doctors who are working in the San Francisco Bay Area or Los Angeles or San Diego to consider living anywhere in the United States that they would like to live. Or in one case, we have a doctor who's living in Cape Town, South Africa. As long as the doctor is privileged in 4 different TBH sites and flexible as regard to the location, TBH will fly that doctor at no cost to them and put them up in a hotel whenever they come to work. So it's obvious that flexibility to doctors is very appealing, but it's also very appealing to our customers and to the consumers that consume our service. So in a hospital environment, instead of plentiful doctors working in parallel shifts from 8 a.m. to 5 p.m., we have doctors working from 7 a.m. till 11 p.m. So the doctoring is happening in 2/3 of the day instead of the doctoring happening in 1/3 of the day. So the doctoring happens between 7 a.m. and 11 p.m. and then the doctor goes to their hotel and the nighttime call is done by Dr. Belkadi, who lives in Lyon in France. So he is up and awake and able to make a note directly into the electronic medical record, assuring that the hospitalist is not disturbed during their brief under 8-hour sleep. So from the consumer standpoint, if the doctor starts a patient on a medication, let's say at 7 a.m., and then the patient has a rash in the evening at 8 p.m., the doctor is still in the house. And this is so true with our adolescent hospitals also, where patients tend to have their family members come see them in the evening times after work. So in this model, instead of the doctors being gone home at 6 and 7 p.m. when family members visit, the doctor is still there. And that's a wonderful thing for the families and for the loved ones when they're visiting their adolescents. And if they come back the following morning before work, the doctor is still on the shift. So that's really an extraordinary thing from a consumer standpoint. And the continuity of care is comparable because in a traditional model, you have the Monday through Friday attending and the moonlighter. And in 4 16-hour shifts, you still have 2 doctors in a week. So it's very appealing to hospitals, appealing to insurance companies, appealing to family members, and appealing also to our doctors. For the extraordinarily industrious doctor, and we don't necessarily recommend this, but we do have 13 shifts per month that are 16-hour days. Now those, the base salary is $450,000 per year, plus $10,000 in bonuses and a full benefit package. And the doctor is working 60 hours a week, but still manages to have between 16 and 17 days off per month. So give some thought as to whether or not you think of yourself as somebody who would like to work from 8 a.m. to 5 p.m. Monday through Friday for the same salary, and we'd be delighted. Or if you'd prefer 8 a.m. to 6 p.m., the continuous 10-hour day shift, or perhaps the 12.5 12-hour day shift, or the most popular of all 8.5 16-hour shifts.